In the second section, I'm going to look at how the health knowledge economy has been changing and what kind of challenge this is creating for the organizational arrangements that were established in the 20th century. In this second part of the module, I'm going to explore with you how the health knowledge economy is changing and what this implies for the organizational arrangements that worked so well in the 20th century. Over the past several decades, there have been a whole series of interconnected changes. And whereas any one may not be so important, when they add up to something quite different. So first, there's just been, through mass education, increased levels of literacy. And through schools and through the media, increased general health knowledge. So the asymmetry of knowledge between health workers and their clients may well be diminishing. At the same time, there's a growing body of knowledge on prevention and on low-cost treatment of many health problems. So what half a century ago relied on the art and judgment of an experienced doctor now can be codified in rules that almost anyone can follow. At the same time, there's an increasing availability of low-cost diagnostic technologies and increasingly technologies that anyone can use. We all know how there's been a shift even from taking blood pressure, which required an experienced person to listen through a stethoscope as they released the pressure on an arm, to digital blood pressure taking that anyone can do in their home. So not only are there many more low-cost diagnostic technologies, but they require less and less skill to operate. At the same time, there have been many protocols developed now based on evidence for the diagnosis of a problem and the treatment of a problem, so that information that was only held by experts now is much more widely available. And of course, that's increasing through the spread of mass media, access to the internet, mobile phones, all of which provide access to knowledge and advice to health workers or to those people who just are concerned about their health. There's also been a growth in producers of content, whereas previously you might have to go to a large medical textbook to get the relevant information. Now there are many producers of different kinds of content, including public health services, advertising agencies are producing content, advocacy groups. So there's a lot more potential sources of information on how to act in any circumstance. At the same time, there have been a lot of changes in the health economy. And this particularly applies to many low and middle income countries, where the demand for services has grown much faster than the capacity of government health services to meet them. This is partly linked to just the economic growth and growing expectations and rising expectations amongst people of what they would like to find in the health service and problems in public health systems. In response, there now are multiple providers in terms of training, from specialized doctors to general practitioners to nurses to all sorts of traditional service providers, and to just informal people who have acquired a little knowledge and are offering services. And they are in very different relationships to both the formal regulatory arrangements and to the informal. So in many countries, particularly poor people will now seek a large proportion of their health care as an outpatient or drugs from drug sellers or informal providers who operate entirely outside the regulatory framework. At the same time, complex value chains have emerged across the sectors. So in the health sector, there are service providers, there are informal providers. In the pharmaceutical industry, we have large pharmaceutical companies that distribute drugs. Increasingly, telecommunications is becoming important as providers of information. And the point is that these value chains not only are in different sectors, but they cross different levels. So the global pharmaceutical companies, through distributors and distribution networks, not only have a presence at national level, but may have contact with the informal providers who poor people are using. So we've got really quite complicated markets emerging where people are seeking health care in what we call pluralist health systems. These changes have happened much more quickly than the capacity of governments to set up laws and regulatory arrangements to influence performance. In the first place, there's just simply lack of information. on the rapidly spreading health markets. Quite often, governments don't really know very much about who is providing what services. Even where there are laws, governments have a limited capacity to enforce these regulations. And more generally, the reform of the legal framework has lagged behind changes in both the health knowledge economy and the structure of health markets. So increasingly there's a disjuncture between the regulatory arrangements and the reality of both the health knowledge economy and the health markets. The consequences of this is there are increasing problems with the safety of services, with the effectiveness of services and drugs, and with affordability. Firstly, there are weaknesses simply in public health and health promotion because the health market cannot charge for health promotion messages or for public health activities, and so they have little incentive to carry them out. On the other hand, there are large incentives to sell more drugs, particularly where a health worker earns a profit from the volume of drugs they sell. In addition, there are problems with drug quality, as we have both highly reputable drug companies and very small companies providing a whole spectrum of drugs, from the very high-quality branded drugs to very good generic drugs, to counterfeits and fakes. Because we have more use of good quality and bad quality drugs, there's a growth in illness related to the side effects of treatment. Quite often, treatment may be ineffective, and people may be spending more money than they need to get treatment. And on the other hand, there's a lack of reward for good quality advice and competent services. It's increasingly clear that governments and citizens groups need to act to do something both about these highly unorganized markets and the changing knowledge economy. The question is, what should they do? Interventions motivated by good intentions, but without adequate knowledge of how the different parts of the system fit together, can have unintended outcomes if they are not informed by a systematic analysis of its functioning. And in the next part of this module, I will look at some of the ways one can analyze the health knowledge economy to inform government intervention.